Hi everyone and welcome back to the Old School RN. Today's topic is one that has generated a lot of headlines, a lot of debate and quite a bit of concern amongst our patients. You may have seen reports stating GPs are going private or patients could soon be paying a monthly subscription to see their family doctor. So what is actually happening? Are GP services really about to become private? What is the British Medical Association's so-called Plan B? Could general practice follow the same path as NHS dentistry? And most importantly, what would it mean for patients, NHS staff, and the future of the National Health Service? Let's take a look at the facts. So what's actually happened? Well, recently, within the last couple of weeks, representatives of GP practices voted to explore an alternative model of funding and an organisational change for general practice. This doesn't mean GPs have voted to leave the NHS, and it doesn't mean this will suddenly be a charge next month, and it doesn't mean that the NHS general practice has been abolished. Everything's staying the same. What it does mean is that many GP leaders are expressing very serious concerns about the sustainability of the current system. And the British Medical Association, who watch and look after GPs and doctors and monitor their practice, is consulting GPs about what happens if the existing contract arrangements continue to increasingly become difficult to operate. And this discussion has been known as Plan B. And at this stage, it's a conversation purely. No policy, no government policy, that's not legislated, it's not an approved replacement for the NHS. It's a conversation and a debate about an alternative to the current system. But it is a conversation that would have been unthinkable 20, 30 years ago, definitely. So why are some GPs concerned? To understand this debate, we need to look at what has happened in general practice. The population is larger, people are living longer, patients have more chronic illness. GP practice now manages conditions that decades ago would have been followed up in a hospital clinic, and you can see my advice and guidance video coming up tomorrow. At the same time, many GPs argue that workloads have increased, administrative tasks have expanded, recruitment has become more difficult, and fewer doctors wish to become GP partners. Running a practice has now become more complex, and some practices are really struggling to recruit doctors. Others struggle to recruit nurses. Many struggle to recruit even reception and admin staff. And as a result, many GPs believe that they are being asked to do more and more work with more limited resources. And whether you agree with that position or not, it's the argument that's driving this current debate. Now, the other side of the debate is a reduced service for people? Is this a reduced service for people using the NHS? I'd say potentially, but not necessarily. If you've got a subscription or mixed NHS private model, there are two possibilities here. Scenario one, the NHS remains largely unchanged and the subscription buys additional access, longer appointments, enhanced services, preventative healthcare reviews, etc., etc. Scenario B, more clinicians gradually spend time providing subscription services, meaning NHS patients may find access becomes relatively more limited. And critics worry that scenario B is what happened in parts of dentistry. Now, supporters will say that without new funding models, some practices will become unsustainable anyway. But is this a way of breaking the original 1948 NHS contract? And I suppose it's how you define what the NHS contract initially was. When the NHS was founded by Ennure and Bevan, the principle was healthcare available according to need, not ability to pay. So technically, NHS services have already evolved significantly since 1948. Prescription charges started 1952, dental charges followed, optical charges followed, and private practice has existed alongside the NHS and does today. So some would argue that the original model has been changed many, many times anyway, but opponents of a subscription-based GP care system argue that enhanced access to primary care could be one of the biggest departures from Bevan's original vision. So is introducing the public to pay for every service? No, there's no evidence to say that proposing charging is going to affect every service. However, critics of the NHS reforms over the last 30 years have said that there's a gradual shift towards market mechanisms, contracts, private providers, and patient choice models. And some see GP prescriptions as another step along that path. Others see it simply as a survival strategy for struggling practices. And whether this is a debate or a policy direction or an unintended consequence, that's where political opinion divides. So would it stop abuse of the system? Possibly. One argument is that people sometimes access services inappropriately because there's no direct cost. So the examples that are often given are repeat appointments for minor self-limiting illnesses, coughs and colds, missed appointments, multiple consultations for the same issue, excessive demand for certificates and paperwork. Now, some economists will argue that when people contribute something financially, they're more selective about its use. However, there's another argument to this, because healthcare is not like buying an appliance from Tesco's. People may delay seeking help because they can't afford it. And that can lead to later diagnosis, more severe illness, higher overall costs. And the American system is often cited as an example of delayed presentations caused by lack of finances. So would it create a two-tier system? That's probably the biggest criticism, I'd say. Many have already mooted this is already a two-tier system. Someone who can afford a private GP, private scans, private surgery, already has faster access than someone who relies solely on NHS care. So the real question is whether a subscription-based GP model would widen that gap or not. And critics of this idea believe it would. The supporters of the idea argue that the gap already exists and that preserving local GP practices is more important than maintaining a funding model that some practices say is failing. So if NHS GP practice becomes unsustainable under the current model, what happens next? So there are only 4 options. 1, government increases funding substantially. 2, government reduces what GPs are expected to provide. 3, technology and workforce changes will improve efficiency, AI. And 4, alternative funding models will emerge. So the British Medical Association's Plan B discussion is basically like option 4. So whether patients view that as sensible reform, a warning sign, privatisation under another name, or just simply a negotiating tactic depends largely on their political perspective and their view of what an NHS should look like in the future. And that's why this debate is likely to become one of the biggest NHS stories in the next few months, if not years. So let's go back. What is a subscription model? One proposal being discussed is this in subscription system. And that would not necessarily mean paying every time you see the doctor. Instead, it could work more like a membership model. Example might be patient pays a monthly fee, £10, £20, maybe more. And in return, they'll get faster appointments, longer consultations, access to a named doctor, direct telephone health, preventative health reviews, and more. Who knows? Some private GP services already operate in that way, and the exact details have not been decided because there's no final model currently in existence. However, this concept has attracted a lot of attention because many people immediately are asking, and rightly so, does this make a two-tier health service? And that's where the debate becomes much more complicated. So could general practice follow what happened to dentistry? Now, many people will compare this situation with the NHS dentistry. Many elder viewers will remember a time when finding an NHS dentist was so straightforward. Today, many patients struggle to find an NHS dentist. Large numbers of dental practices now operate fully private, a mixed NHS and private in some kind of ratio, and membership-based plans. Now, many dentists will argue they've moved away from NHS dentistry because they believe the NHS contracts were not financially viable. The government wasn't paying dentists enough money to do certain work. so they pulled out. Now, some GP leaders are asking whether general practice will eventually move in the same direction. And supporters of this will say a mixed model might save struggling practices. Critics will argue it could leave vulnerable patients behind. And both arguments need to be discussed and open to consideration. Because in reality, that's something nobody yet knows. Because general practice would move in significantly more to that direction, having broke away from the basics of the NHS principles. So what are the arguments for and against? Well, the supporters of it will say this new model can improve recruitment. It can retain experienced doctors, reduce burnout, provide more time per patient, and create financial stability for practices. Others argue that if practices collapse entirely, patients would be left with even fewer services than before. And the critics will say a subscription-based service could create inequality, priority to those who can pay, increase health disparities, and shift the NHS towards a market model. Critics of this have also pointed out the NHS was founded on the principle of Bevan that care should be available according to need rather than the ability to pay. And that's why this issue is generating such strong discussions and emotions. Not because it's about GP funding, but it's about the future of the identity of the NHS itself. So what's the bigger question? Well, I'd say the most important question isn't are GPs becoming private? The more important question is, why are increasing numbers of healthcare professionals discussing an alternative to the current system? So whether you support this reform or oppose it, the discussion tells us something very important, that many frontline clinicians believe pressures in primary care are reaching levels that require major change. And the government argues that investment is increasing and reforms are underway. GP leaders argue that more substantial action may be required and that patients simply want access to safe, timely care. And I think that's something we can all agree on. So whatever happens next, I think one thing is very clear. This debate is likely to continue for many years. General practice has always remained and will remain the front door of the NHS. And if that front door struggles, the effects are felt throughout the entire healthcare system. The challenge to policymakers, clinicians and patients is finding a solution that remains sustainable while preserving the values that people believe define the NHS and what it stands for. I'd love your views on this. What do you think about this? Do you believe a subscription model would save general practice? Or do you think it will fundamentally change what the NHS was built for and stands for? Please let me know in the comments and tell me from what perspective you're coming at this and what your experience is, carer, nurse, doctor. If you've enjoyed the video, please like, share and subscribe, and I'll see you again. This is the Old School RN.